Welcome to Swansea University Medical School. My name is Paul Jones. I'm the Programme Director for the medical programme. I've been very fortunate, having been born and brought up in the area on the Gower Peninsula, and then having moved away and lived abroad, and had come back when we opened the medical school in 2004. I started off by teaching some clinical skills, and then 10 years ago became the Programme Director. And we've just watched the programme go from strength to strength, and I think we're very lucky. I will be introducing Dr. Awan Ramachandran afterwards, who is one of our admissions leads, but I will start off by just running through a little bit more about Swansea, a little bit more about the programme. As Emma said, if you have any questions to ask, don't be frightened to put them in the chat. What we will do this afternoon when we come back at 5:30 is a question and answer session. We will address all those questions then. So obviously, if you don't understand anything as I'm going through the presentation, do put your hand up, and you can put your hand up or put a question in, and Cecilia and Emma will be looking at the questions. If they feel I need to be interrupted, they will interrupt me so I can explain a little bit more detail. So let's talk about why medicine in Wales. We know there is a tradition of leading the way in the health service, particularly in Wales, with Aneurin Bevan comes from Wales, the father of the National Health Service, and we have our very own homegrown Julian Tudor Hart, originator of the inverse care law. And those of you who like the history of medicine will be able to look at the effect that had on poverty and the way in which we look at social care across the whole piece of health service. So why medicine in Swansea? We're one of the few medical programs in the country that do graduate entry only. Most medical programs, you go straight from A levels, straight from school into medical school, but us and Warwick and a couple of others now starting to come online are graduate entry only. And therefore, and we know from our experience, and I'll talk about this a little bit later on, that we know we're producing good doctors. We've been on the market since 2004. We've been producing graduates now for quite a few years, and some of our early graduates now are general practitioners, and some of them indeed have achieved the dizzy heights of going on to become consultants in secondary care in hospitals. We have excellent teaching clinical learning facilities in fairly authentic settings all across Wales, not just in the Swansea area. The students from Swansea go all over Wales, and then we have started to branch out, and working with Cardiff and the funding that follows medical students, we're able to facilitate very good learning facilities in all those places around Wales. We are a fairly small medical school. We know that in terms of medical school sizes, we've got about 100 students. Most medical schools have got, say, 2, 3, even 4 or 500 medical students. And therefore, we know that our staff-student ratio is very good, and therefore we're able to provide very good support. And those of you who know the Gower Coast, those of you who don't, can Google it in terms of the beautiful environment. There's the nearest campus to the sea. And we have a lovely environment to live in, which is why, having been brought up in the area, that many years later, I came back and this is where I live now. So right near the sea, lots of facilities and lots of things for you to be able to see. So is Swansea University Medical School for you? The Times, the Sunday Times Good University Guide in 2021 put us as the top 3 in the UK for medical schools. In terms of medicine, the Guardian University put us in the 7th in the UK. We were 1st in the UK for research environment and 2nd in the UK for overall satisfaction with genetics, which is one of the programs we run from the medical school. But what about Swansea University as a whole? The Guardian University Guide puts us in the top 25 of all institutions, and there are many other reasons to study at Swansea University, all of which you are more than capable of looking on the internet and Googling and finding more information about. So where is Swansea? It's in southwest Wales, with the 2nd largest city in Wales, a population of over 250,000 people. We have 2 seafront campuses, and it's right on the edge of the Gower Peninsula, which is one of the areas of outstanding natural beauty. And our 2 campuses, particularly the Bay campus, is even closer to the sea than the Singleton campus, but our campuses are the closest to the beach in the whole world. We're literally on the beach. So you look out when you're in the university out to the sea, and we know that we're not very far from lots of central services. We're less than an hour from Cardiff. In actual fact, I always say that it's quicker to drive to Cardiff and take the train, because the train from Swansea to Cardiff isn't as quick as then the train from Cardiff to London. We're less than 3 hours on the train from London, and it's a good journey to travel down on. So what is Swansea like? As I said, I know we advertise that it's near the beach, but that's not why you're here. It's one of the reasons why hopefully you choose Swansea, but one of the reasons is that it's, yes, by the sea, but it's very affordable. And when you come to talk about in your groups with the students, they will talk a little bit about accommodation and how easily manageable it is in terms of finances to live in the Swansea area, a lot cheaper than other parts of the country and indeed the world. So let's talk a little bit about the healthcare delivery that we talk about. We know we have an aging population, a lot more long-term conditions, which has been putting a strain on healthcare resources, particularly now with the COVID crisis. And I'm sure that you will have some questions later on about that, and we will address any of those that you come up with. And that we know that we're starting to look at the care being delivered closer to where people live. The idea, and we've very much looked at what we call a pendulum shift in terms of resources. Many years ago, we had lots of small cottage hospitals. We started to make the move towards big district general hospitals. We're now starting to go back and thinking we need those small cottage hospitals again, because sometimes care needs to be closer where people live. Integrated care, so thinking about working with other disciplines, is central to the delivery of future healthcare. And we know that with the advent of technology, that remote patient monitoring will transform the way in which we look at diagnosis, treatment, and indeed managing disease. We're very fortunate, I'll talk about this a little bit later on with one of our data science buildings, is that we use big data. So starting to look at population statistics, starting to look at data that will inform us about how we can treat diseases nowadays. And maintaining health and well-being is becoming an increasingly important aspect of healthcare, with very much prevention being a key focus. So let me tell you a little bit more about the program itself. It's a graduate entry degree. Most of you will know who you have read, and I'm hoping that most of you who are here today will understand it's a 4-year program as opposed to a 5-year program. We split the years into phase 1 and phase 2. Phase 1 is basically years 1 and 2, and phase 2, which is years 3 and 4. And we have very much a spiral integrated curriculum. Spiral as in, we don't just, because most, if you look at A-levels and GCSEs and other university courses, they very much run a modular system where you're taught something, you're tested on it, you pass it, and then you move on to another topic and you forget about the last topic. Medicine isn't like that. Medicine is very much spiral, as you build on the elements of what you have in the first week into the second week, and it builds on as time goes by. We also run a very integrated curriculum. Lots of medical programs around the world now are starting to be more integrated, where you're learning science and the art of medicine alongside of working clinically. But we have very early integration into the clinical environment. And we were very fortunate when we set up the program 16 or 17 years ago, that we worked very closely, as we had to, with the General Medical Council, which is the regulator which supports us in terms of running the medical school, and that we have 3 modules. And that's how we fit into the university system. And 3 modules are the knowledge you need to be a doctor, so the doctor is scholar and scientist, the skills that you need to be a doctor as practitioner, and the behavior and attitudes that you need to exhibit as both as a medical student and as a qualified doctor, and that's doctor as professional. So what are the benefits of studying medicine after graduation? We know that students are more mature and therefore they tend to make better career decisions. You've all gained some life experience, and therefore we have found, and we know from feedback from not just in Wales, but all around the country, is that you make better prepared doctors because you are a little bit older. You have university experience, and we have a very good success rate, a very low attrition rate from students who don't make the course. In actual fact, you probably look at from each cohort, probably only 1 or 2 not getting through to the end of the program. And that's not usually due to the fact that they can't do it. It's usually for personal reasons, that they decide to go and do something else, or they decide that they want to branch out into other things. We know that the richness of study experience of getting different people from different backgrounds gives a very diverse background to the cohorts of students that we've got. And we know that going forward, that when you work as qualified doctors, over the last few years, it has been said that Swansea students and that their own evaluation and the consultants they work with have been the best prepared when they complete. So how do students get into GEM? We call GEM Graduate Entry Medicine. We have a number of pathways. There is a Pathways to Medicine programme of which you can do a degree within Swansea of Applied Medical Sciences with a foundation year, medical biochemistry, genetics, pharmacology, and population health and medical sciences. And that leads us into the Pathways to Medicine programme. And eligible students, and there is criteria to be made from that, choose then a pathway to medicine, will be guaranteed an interview, not a place, but guaranteed an interview for the actual graduate entry medicine programme. And lots of people, when they're looking at their UCAS options, use it as an ideal fifth access for people who are keen to study medicine in the future. So let me run you through a little bit of the philosophy of the programme. Our curriculum philosophy is based around the success of the programme itself. Situated in the clinical setting, you learn to be a doctor by doing what a doctor does and context-wise where a doctor does it. It's very much student-driven. We maximise the opportunities for all learners to work it out for themselves. It's not a problem-based learning programme where we just give you a topic and you have to work it on your own. We give you guided self-study alongside lectures and other aspects within the programme. I've already said that it's spiral. We revisit, we come back to topics, we start off with topics in the first year, and we build on those throughout all 4 years of the curriculum. We very much know and have realised and have achieved that we need to simulate clinical practice. We know that the world we live in is varied, it's complex, it's uncertain, never so more at this time with the COVID crisis. And therefore, all our teaching is centred on patient presentations and clinical cases. I've already mentioned as well that we're small, and therefore we're able to provide very good support with a relatively, compared to other medical schools, small intake of students. And then we need to think about why we're here at the end of the day. We're here to serve the needs of patients and the public. And that reflects the needs of the patients and communities in the idiom thinking globally but acting locally. So we learn from other people as well. So where will your medical studies take place? In the first 2 years, most of your studies will take place on the Swansea University campus. You can see the Grove building here on the right-hand side. And we have other links into our local hospitals. So the Morrison Hospital, the Education Centre, which has not all that long been finished and completed, has a central hub where we do a lot of our teaching. But we do use a lot of the local hospitals from Singleton and Morriston to Kevin Coyd and Neath Talbot, all the way down to over to Carmarthen, Aberystwyth and Llanelli and Haverfordwest. So there are elements that we use all over Wales, and there is an expectation that when you're with us, you won't just be in Swansea. We want to expose you to different health boards, different hospitals in different regions of Wales. And the medical school facilities, we're very fortunate that we've had funding from Welsh Government to support our Institute of Life Sciences. We know that the medical school is based on the Singleton campus, and this is where we do our anatomy, our clinical skills teaching for both our medicine and our physician's associate courses. And we have pharmacy laboratories located at the back of the Grove building. The Institute of Life Science 1 and 2 and the Data Science Build, they are Wales's premier medical research facility, and they represent the single largest investment ever made by Welsh Government on any university campus. And that informs us in terms of thinking about how research is going forward in the region. The Data Science Building, completed in 2015, was developed as a world-class centre in e-health, and that very much looks at big data, thinking about how we can look at the population, looking at data we gather from individuals in an anonymous way to inform us about ongoing treatments within medicine and healthcare delivery. And then more locally, within the medical school facilities within Morriston and Singleton and the Grove, we have a myriad of opportunities for you to learn, whether it be in the anatomy lab, whether it be in the clinical skills areas. We have MRI facilities in terms of research. And then obviously, thinking about research, the labs that people will be working in. So I've already said that you will be all over Wales. So where are your clinical placements? Most of them will happen in the local geographical area around Swansea, but you will be expected to go up to Aberystwyth, over to Haverfordwest, Carmarthen, Llanelli, and we will stretch. Where we don't tend to go is very much east. So we tend to find that Neath Talbot is probably the area which we have here, which is near Cardiff, is used for Cardiff Medical School placements. And there isn't a clear divide, and we're starting now to work a lot more with Cardiff in terms of sharing some of those placements. But it is important that you have an identity, knowing that where you're going to be when you're doing your studies. So let me run you through a little bit more of the programme itself. Phase 1, or years 1 and 2, very much based around learning weeks, which are all case-based. Every single week that you have in the first 2 years includes an aspect of what we call integrated clinical method. And this is where you learn how to examine patients, how to take histories, how to do practical procedures like taking blood. In the first 2 years, every 4 or 5 weeks, pairs of students work with community-based learning. So they work with general practitioners, they're based in a GP practice, and they gain a longitudinal progression through that experience. Most of you will have read online about locks. They are a unique feature of the medical program on the GEM in Swansea. They are learning opportunities in the clinical setting, and they are half-day clinical experiences which are student selected, and students get the opportunity to be able to choose from a myriad of places, whether they want to work on the paramedic on the back of an ambulance, whether they work with a homeless nurse in a homeless centre, whether you want to see a post-mortem, whether you want to work with a cardiothoracic surgery, doing heart surgery. So there's a whole range of opportunities which you can book in to see and then experience them as you would a normal clinician. And then we have the early apprenticeships in phase 1. These are 5-week placements which you spend totally out in secondary care, working in hospitals alongside consultants and other senior members of the team. Phase 2 is very similar. Years 3 and 4, again, we have learning weeks, but there are less learning weeks in years 3 and 4. Again, they're all case-based. The clinical apprenticeships, or the time that you spend in secondary care, which is hospitals, and primary care, which is GP world, are slightly different. We have 3-week-long apprenticeships that you can work in specialties that you wouldn't normally in a medical school. And then in the final year, the 5-week junior assistantships, which are a rotation between medicine, surgery, and GP. Community-based learning in year 3 is usually one of your 3-week intermediate apprenticeships in year 3. And then the penultimate year is very similar to what other medical schools is specialty attachments, that's where you learn the specialties of medicine. We have an elective at the end of year 4, and I'll talk a little bit about that later on. And at the end of the program ends with a senior assistantship at the end of the year, prior to you becoming an F1 and working as a practicing clinician and doctor. So this is the curriculum map that we have got. If you look at the whole of the map, we've got each of the years 1, 2, 3, and 4. If you look at the blue is essentially what I call university academic contact time, and the yellow is where you are working in a clinical environment. And you can see right from the word go, you have a little bit of clinical experience all the way through first year. You can see that as you get into second year, there's less blue, there is more yellow, so you're spending more time in the clinical environment. And when you get through into the 3rd and 4th year, you can see that there is very few university academic contact time. Most of the time you are spending is working on the wards, working alongside consultants in specialties and the further apprenticeships. And I won't go on too much about this, it's way too early, but the red things you can see, red is always mean danger. Those are the assessment periods. So that's when you are tested on what you learn as you go through the program. But we won't go on about assessment now. It's way too early to think about that. So let me explain a little bit more about the learning weeks. All the learning weeks are assigned to a curricular theme. and they provide the context for all the teaching of that week. And we have certain elements that make up what we call a typical learning week. There is the case of the week on the Monday, they lead through in tutorials, and we have certain strands, so anatomy, physiology, going through the whole of the program, pathology and diagnosis, medicine, health and society, the softer side of medicine, and then, as I said, in the first 2 years particularly, a concentration on the integrated clinical method, which is where you learn all your practical skills and how you function as a doctor in terms of taking histories and examining patients. One of the successes is being self-directed, that we know that this is fundamental to the GEM program. We know that the whole of medicine is vast, and as quickly as you teach something, so policies and guidelines, as more research comes into being, some of those guidelines and policies change, and therefore it's impossible to cover the whole of medicine in 4 years, in 5 years, or even 6 years. And therefore it's important to signpost you to where you can read and develop further knowledge. And as practicing clinicians, it will be your role when you're working, just the same in any healthcare profession, whether you're a nurse, whether you're a physio, whether you're a physician's associate, you need to keep up to date. So what we give you the skills to do is to think about where to go to keep up to date, to make sure that the resources that you're using are cutting edge and innovative. So the clinical apprenticeships, those 5-week placements in the early years and the 3-week placements in 3rd and 4th year, where you work in secondary care or in primary care. And pairs of students are allocated to a consultant or another senior member of a team working in hospitals. And the primary purpose, as it says, an apprenticeship, whenever I think about apprenticeships, I always think of a plumber mate working alongside a plumber, learning in an apprenticeship model how to be a qualified plumber. And the primary purpose of our apprenticeships is that you learn about being a doctor and the general practice of medicine. And it's not particularly at this stage in the first 2 years to learn this particular specialty. That comes later on. That comes when we think about the specialty attachments, which are 3rd year. They have 8 5-week clinical placements in 3rd year, at the very beginning of the final year in the 4th year, and they are a range of topics between acute medicine, surgery, frailty or looking after the frail elderly, rehabilitation and general medicine, that what I call the super specialties, the women's health, child health, and the mental health, and then the smaller subspecialties of medicine and surgery. And the specialty attachments in 3rd year and the beginning of 4th year are very much structured learning experiences for you to learn about the health needs of and the care provided to specific and particular groups of patients. All our specialty attachments are based in hospitals and community services, and you do it on a rotational basis so that you go around in about groups of about 10 or 12. And you have, when you do those 5-week rotations in the attachments, a number of specified clinical activities. But we know that you just can't all learn it from just working clinically, that there are timetable case presentations, some radiology teaching, simulation, and some further clinical skills practice. And that is 5 days a week for the whole of the 3rd and 4th year. One of the new focuses we have within the curriculum is the Primary Care Academy. There's an option to study our Year 3 based in primary care in Mid or West Wales, working with general practitioners, being part of the primary care team, working alongside those team members. You do the same learning outcomes assessments as all the other students, but it has more of a rural focus, and you have input into secondary care when you need it to see some of those more acute things that you could only see in hospital. But this has opened up the possibility of lots of small group teaching, and we know that we've been running the Primary Care Academy now for 3 years, and the students on it have found it is very beneficial and a very good way of learning. Very much learning medicine through a primary care or community focus. Lots of people excited about coming to medical school, about thinking about electives and international opportunities. At the end of Year 4, there's a 5-week clinical placement where students choose from a bank of approved placements. Most are taken overseas and many in developing countries. We also have the option in Year 2 for 24 students from each cohort to have the opportunity to work in the Gambia under the Wales for Africa system for 2 weeks. But apart from the Gambia placement in elective, there generally are no opportunities to study abroad, apart from possibly military scholarship students. And I think lots of people would think, oh, can I come to medical school and spend a year out? We run such a unique program in Swansea that taking a year out, that it would be practically impossible for you to achieve all the learning outcomes that we would achieve at home. And I think we have had questions in the past about intercalation. Most medical schools now, being 5-year programs, run what we call an intercalation year. Is that somewhere possibly between your second or third and fourth year, you take a year out and do a degree. You've already come to us with a degree, and therefore there is less need for you to do an intercalation year. We are exploring the possibility of a master's as an intercalation, but that again, that hasn't worked out as yet. I think you have a lot to do as a medical student without taking a year out away from the program to learn something else. That is something which you can do after you qualify. And then our final placement is our senior assistantships. This is a 5-week clinical placement where we have combined with Cardiff, and all the students in Wales are pooled. And where you're going to work as an F1 doctor in August, 3 or 4 months before, you actually work alongside the person you will become. It's a very good way of, in terms of shadowing, and I think it's why our students feel so prepared to work in the clinical environment. And I think being older as well helps, being a little bit more mature. So what have students been doing over the last year? I think COVID has hit all avenues of life, and we know that we have had some students who have joined the NHS workforce. Our students last year in the final year qualified slightly earlier so they could work on the front coalface of the NHS. Other students since in the earlier years had actually set up a childcare facility to look after the children of vital health workers in the region. And these are the sorts of extracurricular activities that we know, because you are more mature, that you want to do and you get more involved with.